Shoulder instability is a common orthopedic problem that we see, and it often results in a loss of function of the shoulder, either from a range of motion, a strength, or a stability standpoint, or creating excessive pain and discomfort for individuals. There's a variety of different ways that somebody can experience shoulder instability, and you can typically categorize it into one of two routes. Either from repetitive and excessive trauma that happens over and over the course of several months or the course of several years. This can be the result of different work or occupational demands or recreational activities, such as throwing. It can also happen from a single incident or from an acute trauma. So think about something such as falling on an outstretched arm, or from having direct impact or contact to the area in a sporting event such as football or rugby or ice hockey. Oftentimes when we have these acute incidents, we may hear the terms subluxation or dislocation occur. A subluxation and a dislocation both are referencing the glenohumeral joint. And what is happening, the ball of that ball and socket joint is moving out of the socket. Now with a subluxation, it is just a small amount of movement where the ball does not go completely out of the socket, and it just goes partially out and then immediately returns. A lot of people say that it feels like their shoulder has slipped. Now a dislocation refers to when the ball goes completely out of the socket. Sometimes it will return on its own. Oftentimes, though, it needs to be physically put back into place. And this is often done by somebody else, or if it's happened multiple times, sometimes the person who's injured is able to do it on their own. But in either incident, after it happens, you want to follow up with an orthopedic, and they will often order imaging, such as an X-ray, to see if there was any fractures or any bony injuries that took place when the two bones moved on one another. And they may also order an MRI. This is going to look at more of the soft tissue and see if there is any damage to the structure surrounding the joint. I think this is a good time to get a little bit more familiar with the overall anatomy of the shoulder. And when we talk about the shoulder, it's actually a complex of multiple joints. We have the glenohumeral joint, which is where the glenoid, which is the socket of the scapula, meets up with the humeral head, or the arm bone. So we have the humerus, which is one bone, we have the scapula, which is another bone, and they create the glenohumeral joint. We also have our clavicle that comes in, and that's the collarbone. And we have an attachment that meets up with the acromion, which is referred to as the AC joint, and on the other end of the clavicle is where it meets the sternum, and this is the SC, or the sternoclavicular joint. The other interaction that we have is the shoulder blade, or the scapula, sitting on the rib cage. And this is called the scapulothoracic joint. Now, all of this is important because when we get into treatments and exercises, they're all going to have a slightly different theme as to what they're trying to accomplish. Now, we know what the bones are that are involved with the shoulder, but there's some other really important structures as well. We have something called our labrum, which is a cartilage that surrounds the inside portion and the outer rim of the glenoid. And the easiest way to think about this is it adds more depth to the joint. So the shoulder itself is a relatively shallow joint. The pieces fit together really well, but there's not a whole lot there keeping it in place. So it's a very mobile joint, but it's not the most stable joint. That's where the labrum comes in. It adds a little bit more depth to add stability for the joint. Now, another structure that we need to be familiar with is the rotator cuff. And it's actually 4 different muscles that come together and share a common tendon to attach to the humerus. And these 4 different muscles are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. These muscles have 2 main functions. They are there to rotate the shoulder, which is why it's called the rotator cuff. But when all 4 of them act together, they not only provide rotation for the shoulder, but they can also provide a lot of compression and a lot of compressive forces for the shoulder joint, acting almost like a suction cup to help keep the ball within the socket. Now this is really important because when we get into strengthening the rotator cuff, we'll show you some different ways that you can strengthen it based on those two different mechanisms that are there. In addition to the bones, the cartilage, and the muscles, we also have a variety of different ligaments, and the ligaments connect bone to bone. And you'll see in this picture that there's a variety of different ligaments within each joint of the shoulder. At the SC joint, at the AC joint, and also at that glenohumeral joint. And the main thing to remember with ligaments is they help provide stability. So when we have a trauma, such as a shoulder instability through subluxation or dislocation, we oftentimes get injuries to the bone at the glenoid and the humerus. We get injuries to the labrum. We get injuries to the rotator cuff, and occasionally we can get an injury to one of these ligaments as well. And that is where different imaging, such as x-rays and MRIs, can give you a clearer picture as to exactly what all was involved and the severity of what was involved with your injury. When we talk about shoulder instability, we're going to focus on stability exercises in this video. It is important to note though that an all-encompassing rehab program would also deal with symptom management and showing you a variety of different ways that you can manage the pain. And whether that's through activity modification and education on what the most appropriate exercises are to do, education on medications, and what your orthopedic or your primary care physician may prescribe you to help deal with inflammation or pain. And then also different mobility drills to make sure that we actually have ideal range of motion and ideal shoulder mobility before going directly into these stability drills. So keep in mind, this video is going to touch on stability, but it's just a piece of the puzzle. And when we get into these exercises, we're going to focus on 5 different categories. Within these categories, there are infinite amounts of activity that you can do in different exercises. So don't think of these as the only exercises that you can do, but think on a bigger picture. The shoulder does a variety of different things. So we want to try to find an exercise that hits on each one of those different ideas. And we're going to show you just 1 or 2 exercises within each one of these categories. So the first exercise we're going to get into is going to target the rotator cuff, and it's going to do 2 different motions, external and internal rotation. And for this, the easiest way to set it up is to get a resistance band, or you can use a cable column or a pulley system in the gym with some light weight. You're going to have your elbow at 90 degrees and your arm right by your side. One thing that you can do is tuck a towel or something in between your arm and your body if you need a reference to keep your arm by your side. From here, starting with the hand in front of the stomach, you're going to rotate the arm out. With this, you want to get the arm pointed directly straight ahead. You can go further than that if it is comfortable, but we don't want to rotate so far that we're twisting and turning our body as well. The rotator cuff is not very strong in relation to the rest of the muscles of the shoulder if we think about our deltoid, our lat, and our pec. So we don't need to utilize a very heavy resistance for this. We typically are using a lighter to a moderate resistance with higher repetitions. So we're often doing sets of 15, upwards of 30 repetitions. Now this motion going away from the body is external rotation. The other version is internal rotation. And just to keep the angle appropriate, I'm going to switch over to the left hand. And what you'll notice with this is we are now starting away from the body and we're pulling in. So the motion is the same as the last one and the position is the same as the last one. We're just now pulling the resistance towards our body as opposed to away from our body. Now, internal rotation is not only the rotator cuff, but you also have the pec and the lat muscle that are internal rotators as well, and they are big, strong muscles. So with this exercise, Because you're also working those muscles, it tends to feel and be a little bit easier than going away from the body. So you may notice different things from a fatigue standpoint or from a challenge standpoint, and that's okay. With external rotation, when we're going away from the body, we're going to be targeting muscles on the back side of the shoulder. When we are pulling towards our body, the subscapularis is actually underneath of the shoulder blade. So you may feel something around the shoulder blade, but you may also feel the muscles on the front part of the shoulder working as well. With these activities though, you can do them in sets of 15 to 30 for 2 to 3 reps, and it should be a slow and controlled pace. So we just wrapped up doing some rotator cuff specific exercises. This next one is not only going to train the rotator cuff, but also some of the scapular muscles. And these are the muscles that go across the top of the back in between the shoulder blades. With this activity, we're going to be on the dumbbell bench and we're going to be lying on our stomach with our head just over the end of the bench. Our arms are going to be out to the side, so it's going to look like we are in a T position. And there's going to be 3 different exercises from this position. We're going to have the palms facing down, we're going to have the thumbs facing down, and we're going to have the thumbs facing up. With this, you're going to put the shoulder in different positions of internal, external rotation, or a more neutral position. So that's how you're going to bias a little bit more of the scapular muscles or combining the scapular muscles with the rotator cuff. Typically thumbs down is the easiest position, palms down is the next most challenging, and then thumbs up is the most challenging of all of them because it puts the shoulder in that externally rotated position. I'm going to go through a few different exercises with those 3 positions, and you'll see some text pop up, and that's going to show you some key things to think of and to do as you're running through these activities. We don't need a lot of weight for this. Oftentimes, I'll have people just start with the weight of their arm and then progress up to 1 pound, 2 pounds, maybe 3 pounds, but we do not need to use a lot of heavy weight for this. I would encourage you just to start with the weight of your arm. So far, all of the exercises that we've done are what we would call open chain exercises, meaning the hand is moving freely through the air. The next one that we're going to do is going to be a closed chain exercise or a weight bearing exercise. And it means that the hands are actually going to be stationary on the ground as we are moving the body. Now, that is less important to know, but the one key characteristic of this is that there is going to be compression going into the shoulder joint. So that's not only going to stress the rotator cuff and the muscles localized to that area, but we're also going to get some more involvement and more engagement of the other muscles of the trunk, upper back, and core as well. So the first thing that we're going to do with this is going to be a quadruped or a bear hold position. So for this, we're going to have hands and feet on the ground, and we're just going to hover our knees. And from this position, we're going to hold for 5 seconds and then go back down. So as we hover the knees up, you'll feel more weight going into the hands. So it's going to increase resistance by increasing the amount of body weight we have going through our hands. Now, with this activity, our hands are right under our shoulders. It's a pretty stable position. So when that gets easy, then we can go into more of a downward dog position. Now, most often that's used with yoga from a mobility standpoint. But for this, what it allows us to do is it allows us to get the hands away from the body and into a more overhead position. So you'll see as I lift my hips up, my body drifts back and the hands get further out in front of my body. With the first exercise that we did, you can do that for a 5-second hold for a set of 5 repetitions. For the downward dog, that one is more of a continuous motion up and down for a set of 10. Now, a common theme with both of those, both hands were on the ground. So yes, we are having to bear our body weight, but we're still pretty stable. This last exercise is going to involve lifting a hand off of the ground. So we'll go back into this quadruped, all fours, kind of bear hold, bear crawl position. But what we're going to do now is we're going to alternate tapping our other hand. Now when we do this, we go from both hands being on the ground to only one hand being on the ground. So we're going to have to stabilize ourselves with one arm. Now the other thing, when I do this again, watch my shoulders, and they should stay pretty parallel to the ground. Meaning, when I lift my hand, I stay flat and I'm not letting my body rotate. So you want to minimize the amount of movement that's happening as you're going side to side with the hands. We don't want our body drifting too far side to side, and we don't want our shoulders rotating. With that, I like to do a set of 20. 10 taps with each hand, steady pace. Think about minimizing movement as much as possible. Those are 3 different weight-bearing activities that we can do to get more comfortable in weight-bearing and compressed positions. The next exercise to do is one that deals with distraction of the shoulder, or think about the arm being pulled down. And the way we're going to have that arm pulled down is by holding some heavier weights. So a really good exercise to help train this function are farmer's carries. And with this, you can utilize dumbbells, you can utilize kettlebells, or anything that's heavy that you have around the house. And with this, you want to get a weight that is challenging enough for you to hold, but you feel safe walking a distance with it. In our clinics, we have about 25 to 30 yards of turf space. So a common way that we'll do this is we'll ask an individual to get 2 dumbbells. It may be 20 pounds, it may be 50 pounds, depending on their strength and their overall size. But we'll have them walk the length of the turf down and back. And the rules that we give them is the weights should be by their side, but they should not be touching their side. So with this, you can use as heavy of a weight as you feel comfortable gripping, like you are not going to drop the weight or it's not agitating the shoulder. And we typically do 2 or 3 laps of 50 yards at our clinic. In a gym or in a house, if you don't have that much space, just find an open walkway and do several laps. Our last exercise is going to deal more with reactive strength, or that quick twitch and that fast twitch muscle fibers. If you're returning to a sport that involves throwing or swinging or any sudden movements, this will be really good to do. It's also beneficial for individuals who their shoulder doesn't give them much issue throughout the day, but if they have to reach real quick for something, say they notice something is dropping or falling, and they catch or they feel their shoulder do something out of the ordinary, this may be an exercise that helps with that. So this is going to be a ball drop exercise, and we're going to do it from 2 different positions. Both of them will be lying on this bench. Both of them will be on our stomach. One will have the arm out to the side like this. The other will have the arm out to the side like this. When the arm is straight, the motion that's happening will look more like this as we drop and catch the ball. When the arm is in this position, the motion that will happen will look more like this as we drop and catch the ball. So the bent arm position has a little bit more rotation involved with it. So I'm going to go through about a set of 10 in the straight arm position and in the bent arm position. With this, you can drop and catch the ball as quickly as you are able to. And keep in mind, there is a skill component to this. So if catching the ball is too challenging, you can do the same motion without the ball and just move the arm quickly. So in this video, we covered shoulder instability and, more importantly, strength exercises to help with shoulder instability. These exercises will help reduce pain and improve the overall function and stability of the shoulder. Keep in mind, if you are dealing with this, be sure to seek out an orthopedic or a physical therapist to do a comprehensive assessment and make sure that these are the most appropriate things to do But more importantly, get a big picture holistic program of what all is most appropriate for your given scenario, whether that's pursuing imaging, needing any medication, or if you're really having issues, is surgery the more appropriate option? If you like this video, please share, like, and subscribe, and stay tuned for more videos from Rehab to Perform and R2P Academy.